Hi, my name is Joseph Lozardo, and I'm going to talk about Volanesorsen triglyceride levels in a family chylomicronemia syndrome. Definition: it's a serious disease that prevents the body from breaking down fats. Eating even a little fat can make someone with FCS ill, and the condition causes chronic symptoms and can lead to potentially fatal pancreatitis. FCS is a genetic disorder passed down from parents.
We're enrolling in a phase 3 clinical trial for familial chylomicronemia syndrome. Patients with FCS have excessive levels of triglycerides and are at risk of pancreatitis and recurrent pancreatitis, which could be life-threatening. ApoC3, which is our target, which we knock down with our drug, actually impacts the clearance of chylomicrons, which are packets of triglycerides from the blood. And so the hope is that we're able to knock down the ApoC3 and therefore the triglycerides and prevent pancreatitis in these patients. And we're also starting a second clinical trial with the same drug target for knocking down ApoC3 for patients with familial partial lipodystrophy. For patients with familial partial lipodystrophy have defective adipose tissue that results in significant metabolic manifestations, including high triglycerides and high ApoC3. The patients have high insulin sensitivity and subsequent diabetes, and actually end up many times either with life-threatening pancreatitis or liver disease or cardiovascular disease. And so by the ApoC3 is our target for ApoC3 is to knock down the triglyceride level and their risk, therefore, of these severe disease manifestations. And that trial will be up and running later this year.
Applications in medicine. After a 6-week stabilization run in period with patients were applied to follow diet. The included less than 20 grams of fat per day. Patients with fasting baseline triglyceride levels of 1750 milligrams per deciliter of higher were randomly assigned in a ratio to Volanesorsen at dose at 300 milligrams per week or placebo. Volanesorsen or placebo was administered as a single subcutaneous injection once a week for 7 weeks. During the trade reduction of dosing than once every other week was allowed if unacceptable side effects or adverse events occurred. Pros and cons. Volanesorsen lowered triglyceride levels irrespective of the patient genetic diagnosis. At 3 months, mean triglyceride levels were decreased by 75% in the 17 patients with diabetic mutation in LPL and by 75% in the 9 patients with non-LPL genetic deficient patients with mutation in APOC2, GPH, BPL, APOA, and LMFI, are showing marked triglyceride decreases. Treatment was also effective irrespective of baseline triglyceride levels and was equally effective in patients receiving baseline N3 fatty acid, fibratic therapy, or HIC, and patients not receiving those therapies. Issue applied in Ecuador. There were no reports of volanesorsen and triglyceride levels in a familial chylomicronemia syndrome in Ecuador. Conclusion. In conclusion, volanesorsen lowered triglyceride levels to less than 1750 milligrams per deciliter in 77% of patients with familial. Chylomicronemia syndrome, thrombocytopenia, and injection site reactions are common adverse events.
FCS is a genetic condition. Actually, you inherit one gene from each parent. It presents in childhood often, meaning children have very high levels of triglycerides. They sometimes have pancreatitis. And then it can progress over time to the point where many individuals will have recurrent bouts of pancreatitis that really are often not recognized as being characteristic of this disease. But again, a key consideration is that these patients have very high levels of triglycerides that we don't generally see otherwise. And that's really the diagnostic criterion that allows us to make the diagnosis in these patients.